with cyber threats growing by the day. Keeping patient data safe isn't just a legal requirement, it's a necessity. From ransomware attacks to massive healthcare data breaches, the medical industry is a prime target for hackers. But what can healthcare professionals do to stay ahead of these threats? We spoke with industry experts to get their take on the best ways to protect patient information, go beyond Health Insurance Portability and Accountability Act compliance, and build a culture of data security that actually works. According to Dr. Emily Thompson, Chief Information Security Officer at HealthSecure Incorporate, the number of cyber attacks in healthcare is skyrocketing, especially ransomware incidents. She stresses that if an organization isn't using multi-factor authentication and running regular security risk assessments, they're already behind. The United States Department of Health and Human Services is stepping in with stricter rules to improve electronic protected health information security. Michael Rivera, a healthcare compliance consultant, warns that relying solely on Health Insurance Portability and Accountability Act compliance can create a false sense of security. Organizations must go beyond the checklist approach and take a proactive stance by integrating advanced cybersecurity practices into everyday operations. Simply following regulations isn't enough to truly protect patient data. Similarly, Sarah Patel, a data privacy advocate, emphasizes that patients trust healthcare providers with their most sensitive information. It's not just about meeting regulatory requirements. Organizations need to actively foster a culture of security to maintain that trust. When healthcare staff understand the importance of data privacy, the entire system becomes stronger against cyber threats. The statistics paint a concerning picture. In 2023, 725 healthcare data breaches were reported to the Office for Civil Rights, affecting over 133 million patient records. More recently, a cyber attack on Change Healthcare compromised the protected health information of over 100 million people, making it one of the largest breaches in healthcare history. The impact of these breaches extends far beyond financial penalties or bad press. When patient data is compromised, individuals face identity theft, fraudulent medical records, and even insurance denials due to altered health histories. The Change Healthcare breach disrupted services nationwide, highlighting how cybersecurity isn't just an information technology issue. It's a patient safety issue. So, how can healthcare organizations stay ahead of cyber threats? Experts recommend several key strategies. First, upgrade security protocols by ensuring regular risk assessments and multi-factor authentication implementation. Second, go beyond Health Insurance Portability and Accountability Act compliance by actively integrating proactive cybersecurity measures rather than relying on outdated policies. Lastly, organizations must build a security-first culture, ensuring that every staff member from doctors to administrative personnel understands their role in protecting patient data. Cyber threats are constantly evolving, but healthcare organizations can evolve too. By taking action now, they can minimize risks, strengthen compliance, and most importantly maintain trust in patient care. For further reading, consider Top 10 Takeaways from the new Health Insurance Portability and Accountability Act Security Rule. The United States Department of Health and Human Services is pushing for stronger electronic protected health information protections. Another is Healthcare Data Breach Statistics 2023. A shocking look at how widespread healthcare cyber attacks have become. And last, Change Healthcare cyber attack. What happened? Breaking down one of the largest healthcare data breaches in history.